Well, welcome to the Middlesex Moments radio show. I'm Dr. Anna Wasesha, president of Middlesex Community College, right here in Middletown, Connecticut. And today I'm talking with three individuals, so we're going to monopolize the microphone. It's going to be an interesting round of discussions. Diane Bordonaro is here with us, and she is the director of our non-credit continuing education programs. And we're talking today about two new non-credit continuing education programs, one with Michael Davis, which is an EMT certification program, very intense program, that he will tell us all about. And then the other one is about equine science and animal husbandry, all focused on horses. And who doesn't love horses? Right? So, and Brittany Carroll is here to talk about that. So I'm going to turn it over to Diane, and she'll set the stage, and then I'll get involved now and again with some kinds of questions if I can, if they let me into the discussion.
Sure. So I'm Diane, and I am in charge of the Continuing Education Department. And our Continuing Education Department is growing. We're getting demands from, members of our community to add more classes. We're always looking to be responsive to the community. So two of the programs we've started is the Emergency Medical Technician, or EMT as everyone calls it, and our Equine Studies series. We're just kicking off the Equine Studies series with a class in Equine Husbandry and another one in Basic Stable Management and Horse Business. So we're hoping that the community responds to these, they like what we have to offer, and see the value of our courses.
So let's start with the EMT program, because the registration should be happening now because it starts on February 1st, right?
Students are enrolling now, so Mike Davis is here to talk about it. He is the instructor in the program. So Mike, why don't you talk a little bit about what it's like being an EMT and who would be interested in this course?
Thanks for having me.
Oh, we're happy to have you.
The EMT course here at Middlesex is exciting just because of all the facets where students can work after they become certified. They're able to work anywhere for commercial services such as hunters or AMR to volunteering in their own towns. And also they can work in ERs, nursing homes, and it can be a stepping stone for further education such as working towards their nursing degrees, paramedic, physical therapy, or even physician. And I've had students go through the gamut from my class, EMT, all the way up, to a master's and a doctorate. So this is a stepping stone for students.
Well, can I just interrupt and switch to Brittany, because what is the place of the education you're offering in the greater scheme of things? Because you were just saying basically you could be 16 years old and become an EMT. You could wind up as an emergency room medical doctor.
Sure.
So what about your program?
So for my program, we start for the Equine Husbandry starts at age 14 and goes up, and that's for kids that are in high school, kids and adults too. But for VOAG students, 4-H kids, and then even people that are just interested in learning more about horses. I have adults that have come and worked with me that have always wanted to get involved with horses and didn't know where to start. And this is a good way to kind of segue them into it. It gives them the whole overall picture versus just going in and riding. The stable management part is a little bit more intense. It's for people that want to make a business or have a career with horses, and that starts at ages 16 and goes on. And it's a great course because it goes over everything, not just equine management part. It goes over grooming, stable management, working with vets, things like that.
So what would be the trajectory of that kind of career? If you were 16, let's say, and you really fell in love with this and took these courses, what directions might you go? Would you?
You could be anything. You could be a groom. You can go work with vets. You can own your own business. You can have a horse sitting business. You can go to a college for equine. This could be a stepping stone. You could be a lesson instructor and teach people, feed representative, tax store employee, all different things.
Or probably just a more responsible owner of your own horse if you had a horse.
Yep, for the husbandry.
Well, it's time to take a break, and when we come back, let's do it in the same rotation. We'll go back to EMT and hear more about your program. Well, we're back, and this is the Middlesex Moments radio show. And Michael Davis is going to tell us all about the EMT program, which, as I said earlier, is a very intense program. It's not something you do on a weekend.
It's a very intense program. The program is 190 hours of clinical time, classroom time, and also ER time. Our students will do 10 hours of ER time at Middlesex Hospital, doing assessments, talking with patients, practicing blood pressures, listening to lung sounds, and following cases through the stages of the ER, through discharge or through when the patients get admitted, which is very important because being a student in this situation, it's important to know what happens to your patient after. The course is approved by the Department of Health, Office of Emergency Medical Services, for 190 hours, like I said. So the course runs Monday, Wednesday nights, 6 to 10. The course starts February 1st, and we run through June 23rd.
And so it's both those 2 evenings, and then also you are here on Saturdays.
And one Saturday a month, the first Saturday of the month, we're here 9 to 4, which allows us to have a long clinical day. Our Saturdays are usually set aside as practical days, where we can get a lot of practice done with our mannequins, with all the equipment that we have.
So I imagine that there's a lot of memorization that has to go. You teach a very broad spectrum of topics related to health, from things from my point of view, things that might happen in a car crash, or if there was an emergency delivery of a baby, and you were on the road with someone. So that's like obstetrics, and then maybe drug overdoses. So
we cover the gamut of every medical emergency that you can have, that a person can have. Everything from, like you said, OB to trauma, to all the medical emergencies, chest pain, cardiovascular issues, diabetic, strokes, seizures, overdoses.
So it's sort of like a summary of medical science in 190 hours.
It is. And we also include an anatomy and physiology section. We include medical health ethics, all the HIPAA laws. We cover all of that. We also cover driving, how to drive an ambulance in an emergency, how to drive the ambulance with a patient in back. We cover the gamut of everything that an EMT is going to need to work in the field as a competent EMT.
So would you recommend that your students, be able to devote a tremendous amount of time to study and to, outside of class, or is this something that you can learn in the classroom?
This is a very intense program, okay. Both with the textbook and both with the practical side of things. Students at the end are tested with a written test that covers the whole book, which is 1,500 pages, 39 chapters we cover. And also, students also have to be competent in doing practical skills, such as suctioning a patient, putting airways in, applying oxygen, using a defibrillator, backboarding patients, putting collars on, different dressings we use. So it runs the gamut of, as far as becoming a competent EMT, learning how to put all of these things together as far as learning.
What's the work life like for an EMT? Do you sit around like at the fire station
in
a period of quiet, and then immediately you go?
It all depends on where you're working. If you work for commercial service, you'll be in a truck all day for your shift, going from call to call. If you're for a volunteer service or for a paid service, you'll be at a firehouse or ambulance bay waiting for the next call to come in. So it's different. It's different for everybody. EMTs, we work 24/7. So it's you can work nights, you can work days, you can work every weekend, whatever you want to work. The hours are there. We never know when the next 911 call is going to come in, so an EMT always has to be ready to go.
So the employment opportunities are out there.
They're out there. They're out there. And like I said before, the EMT program, while it's a stepping stone for further things, I've had past students volunteer for their hometown, which is a sense of giving back to your community. Many of the services will actually reimburse for the cost of the course, the volunteer services, which is maybe an incentive for someone to take the course. I've also had students in the past just take the course for knowledge. This is a very advanced first aid course.
It sounds like it. I was just thinking that.
If you have the time and you want to spend some time learning about, how to be an EMT, this is a very advanced first aid course for someone that just wants it for knowledge.
So what about a student would need to be able to devote some time and energy to studying and to learning, because this is very intense, as you said. What about the kind of personality that is required? This can't be a program for everybody.
It's not a program for everybody, but some of the personalities that I've had in past classes include someone who's low key, who doesn't get excited, who doesn't get frustrated very often. Being an EMT, you have to understand that you're always not going to be in the ideal situations, and if you're get excited about something, you're going to upset your patient, you're going to upset the patient's family or whoever's around you. So keeping an even keel, being very level-headed is very important in this field. Very important in this field.
Let's shift a little bit, although we'll go back and forth. First of all, I should shift to Diane, because I left her out of the conversation that I said I would stay out of. So why don't you take it from here?
Well, what I want people to know is that both of these programs were developed because of requests from the community. And if anybody out there is listening and says, geez, I really wish Middlesex Community College offered this type of program, please feel free to give me a call. My number is 860-343-5716, 860-343-5716. And I'd be happy to talk with you and think about adding new programs to our offerings that may appeal to you and people who have your same interests. We hired Brittany because we had people calling us and saying, I really want to learn more about horses. And Brittany is an expert in horses. Brittany, why don't you tell us a little bit about your personal background and how you yourself got involved?
I actually got involved with horses when I was 9 years old. I started taking lessons, and then I started working at barns and volunteering, and I went to college for it. And I learned a lot, and then I eventually started my own business. When I was in college, I had a farm sitting business. I watched people's horses, and that gave me a special niche that not many people have. And then I was a groom. I went and did some work at a horse breeding farm. I've been all over, done just about everything you could think of with horses, between driving and riding and training and breeding, sales, the whole 9 yards. So it's kind of neat. I love what I do, and I know there's a lot of people out there that want to get into this field.
And do you own your own horse?
I own two. I own a larger paint mare, and then I own a little tiny miniature horse named Dixie's Isabella, and she's about 36 inches tall. So I have both scales, really big and then really small.
So what do you do with the small horse? You can't ride her, obviously.
We drive her. She can drive up to 500 pounds on a two-wheel cart, and then she actually is ridden by little kids under 100 pounds. The vet approved her for. She does pony rides. We show her. She's just a great little working animal.
So when students sign up for your classes, will they actually be out in the barn meeting Dixie and working with the horses, or is it just classroom, or is it a combination of both?
It's a combination of both. So we have 4 lectures in both of the courses, and then 2 of them are actually on site at the horse farm. There's 14 different horses you'll be working with, from the largest of the large 17 two-hand to tiny little 36-inch pony. All of them are really well, trained and easy to handle and things like that. So you kind of get a good experience if you're new to it. And then also we can put you in scenarios that are a little more challenging if you've never, or if you have horse experience. You can go in there and work with them and really get an overall experience from, the easiest of the easy to the harder of the hard.
So when you say work with the horses, you don't mean riding, right?
No, this is a non-riding course. This is you learn what you can't learn from the saddle. You learn about grooming, you learn about tacking, you learn about saddle fit, you learn about, signs of health in the horse, you learn about temperature, pulse, respiration, you learn about different ages, colors, breeds, showing different stages of life, how to figure out what your horse nutritionally needs. This is what that course is about. It's about if you have your own horse, or if you want to have a horse, or if you volunteer, this teaches you what you need to know in those scenarios. But then if you want to go and actually work with somebody else's horse and be competent enough to actually deal with other people, this is the course for you. This teaches everything.
One thing that always amazes me about horses is they're such large animals and they have such little feet. Do you put emphasis on their feet and shoeing and different types of shoes and that kind of thing?
Definitely. We don't go into a ton of farrier work, but we do go into the hoof structure, proper conformation, how a horse should move, anatomy and physiology of the horse, vet care and vet analysis and things like that. I would say that horses do have tiny feet, and there's an old saying, no hoof, no horse. So it's really important to make sure that a horse's hooves are taken care of, and this course will show you everything you need for basic care and things like that. And you'll be able to meet hopefully some farriers that'll come out, and you can talk to them. And if you want to go into the farrier and blacksmith industry, you can.
That sounds really interesting. Yeah.
So I'm amazed that there's a blacksmith industry, because we always use that as the example of kind of occupation that has gone the way of the covered wagon and all that, but there are still blacksmiths.
Yes, it's actually a very thriving industry. They had a huge conference just out in Las Vegas a couple months ago. That was pretty neat. They have competitions, and the world of shoeing has changed as the horses have changed. Before you used to put a same shoe on every horse, and now it's more individualized to horses that have injuries, whether it's degenerative joint disease or if they have arthritis. You could have navicular issues or laminitis, where the coffin bone in the hoof actually shifts, so you have to support the hoof. So So there's definitely stuff out there.
Yeah, the depth of your knowledge is really impressive. So we got to go. We have to take a break, as always, and then we'll come back and we'll wrap up talking some more about EMT and horses. Well, we're back to the Middlesex Moments radio show. Today's show is EMT and horses, and I'm going to turn it over to Diane Bordonaro, who coordinates these programs and our other non-credit programs, and she'll take us through to the end of the program from there.
Okay, so these programs are offered through continuing education, and one of the wonderful things about our continuing education department is the courses are open to anyone. So it's very easy to register. You do not have to apply to the college. You do not have to take any placement testing. We don't worry if you have a high school diploma or transcripts or any of that. All you need to do is come in and sign up for the course. You can come in and sign up in person. You can call us over the phone and sign up over the phone with your credit card. We actually have online sign up now. If you want to visit our website, you just go to our website and look under continuing education, and there's a link to sign up online. So any way you want to get into the course, whatever is easiest for you, feel free.
And this Saturday, by the way, which is January 9th.
This Saturday, we're having a big registration day. It's statewide for all of our community colleges. I will be here along with members of our admissions and the registrar's office. We're here to help people who want to just walk in the door and sign up. We can certainly take your registrations right then and there. You don't need an appointment. We'll be here from 9 a.m. to 2 p.m. pretty much most of the day, and we're looking forward to meeting as many people as possible. Okay. And again, I want to say, the registration part is easy. As far as textbooks, Mike's program is going to come with a textbook. The EMT textbook is included in the course. You will also get a stethoscope. Mike, what else are you going to be given?
Stethoscope, blood pressure cuff, your CPR card, which is a BLS provider card through American Heart, and ER shirt to wear when the students go for their ER time.
Okay. And Brittany's courses do not require a textbook. She will be managing the information through handouts that we will provide to you. So the cost of our programs is the true cost. There is no hidden cost. There's no added fees onto the program. The EMT program is $999. Okay. The program is going to start on February 1st. Again, it's February 1st. It's going to run Monday and Wednesday evenings and the first Saturday of every month. All right. Brittany's courses are going to wait till warmer weather because you're going to be out in the barn with the cold weather we've been having. I'm sure that sounds good to you. And, the first one, Equine Husbandry, is going to start March 3rd. It's going to run Thursday evenings from 6 to 9. It runs for 6 weeks, and it's $299. Then following that, she will be offering the basics of stable management and horse business. That is running from April 14th through May 19th, again, Thursday evening from 6 to 9 p.m. All right, and that one is also 6 weeks long for $299. And just to emphasize, of those 6 weeks in Brittany's courses, 4 weeks will be spent in the classroom learning information that she has on hand. Obviously, she has a wealth of information. But the next 2 weeks, we're going to be taking you out to the stable, the equine stable, where you will be doing hands-on care of the horses, learning about saddles, actually looking at different types of hay. You can talk about feeding schedules in the classroom, but you really got to be out there feeling those different types of hay to get an idea of what's good and what you're looking for when you're running a stable.
Checking for mold and things like that, quality and texture and things like that. So it's important to get that hands-on experience. You can't learn everything from a book in this course.
Right.
So I wanted to jump back into this conversation because, Mike, you can be 16 years old and start an EMT program with you. And Brittany, you could be 14 years old
And start
this program. And I'm thinking about the summer. So high school students who are thinking, what am I going to do this summer?
Mm-hmm.
A high school student could come here and take your course, pass the test, be certified, and be working as an EMT this summer.
In July or August.
Yeah, which is amazing.
Sure.
And a 14-year-old, also aspiring to be a horse person, could do something amazing like farm sitting, which I've never heard of before. Yeah. So there are so many things that they could do with their summer jobs. So what a great way to plan for the summer.
Certainly.
This is a really good opportunity for kids that want to get, if they're showing or whatnot, it's a perfect time because it's in the spring before show season really starts up, or people that want to volunteer at either horse rescues or there's therapeutic riding facilities that are always looking for volunteers. This is a great opportunity and a great timing, being in the spring for them to get out there and get this course done and get the education they need to make them more valuable.
I totally agree. So, what if we go back to the EMT? The thing about that is that the students who finish this program will be certified in a national accrediting system. Can you
The
talk
course
about that?
enables them to take a National Registry EMT exam, which consists of 6 practical stations and then a written test. And the state of Connecticut sees that certification as current for.
And it would be a portable license, right? So if somebody moved to New Jersey or moved to Massachusetts?
Exactly. For the first 3 years, as long as a student keeps their National Registry current, you can move. It's 45 states now where you can transfer that certification.
So that adds a certain kind of value to
Sure,
that program. And in the case of the horse program, that's transferable because there are stables everywhere and people raising horses.
Yep, and Connecticut has the largest horse population versus any other state in the country. It's really unique in all the different things you could do. The horse business really focuses on making a business. It's not for hobby. It's for people that want to, take their passion and make it into a career. It looks great on a college resume. It looks great on a resume just in general to have that. Equine husbandry is awesome because if you have a horse or you want to have a horse, I have people that are even close to the retirement age and they've always wanted to ride and never had a chance and they just want to learn more about it. So it really does offer a lot for people that just want more information, and it makes you feel a lot more comfortable. If you have your own animal, you can have you know what vet to call, what saddle pad to use or how to fit a blanket, and you don't have to worry so much about are you going to be able to take care of the animal that you're in charge of and things like that.
I think that actually applies to EMT too, right? Because I think, well, what is the kind of person, what kind of personality would somebody have to be able to deal with emergencies and crises and chaos? But when you know what to do, I think it gives you the ability.
It gives you the confidence. It's
Right.
all about confidence. This course is unlike any other course you can take because, yes, we do lecture, but then like the Monday, Wednesday nights are split. Half is lecture and then half is practical. So it's important for students to know who's interested to know that it's not just sitting in a chair in the EMT class. You'll be actually working with equipment that you'll use in the field. The mannequins obviously are mannequins, but the airways that we use are real. The suction equipment we use is real. The AEDs are trainers, but it's the same type of equipment you'll use in the field. When we have our ambulance, we have an ambulance day where we bring a couple ambulances down and we do our driver training. Those are all real. We do have Lifestar come down, weather permitting and emergency permitting. They do come down for a visit. They do present a lecture, and the helicopter comes so students can actually see inside and see what Lifestar does, because that is an option for students to move on to. This, like I said in the beginning, this is a stepping stone, and students can become paramedics on Lifestar if that's what they choose to do.
Which would be a very active, relatively exciting career, I would think.
Sure.
Same with being in the horse business. A pretty active and pretty exciting lifestyle.
Yeah, it definitely is. It's 24/7. Doesn't matter about the weather. You have to be out there. They're depending on you. And it is physically demanding at times. They are, very large animals and stuff like that. And it's different than dealing with a dog or a cat. Sometimes you do have to pull them around a little bit, but they're pretty docile animals for their size.
So let's wrap up, Diane, with some more just reminders about the times and the dates and the registration.
Sure. So just as a reminder, the EMT program is starting on February 1st. Okay. You can sign up anytime. We're taking registrations for that course now. We do have our big registration day coming up this Saturday, 9 to 2. We'll have staff here at the college for anybody who wants to walk in and sign up for the class. We are going to be here. Same for Brittany's programs. We're taking registration now. The courses are starting in March. First course starts March 3rd, so you have plenty of time to sign up. But we'll be here on Saturday and every day during the week for anybody who wants to give us a call. Certainly can call us. We'll take your registration over the phone. 860-343-5865 is the number for our continuing education department. The number again for continuing education is 860-343-5865, and you can just give us a call and we'll sign you right up over the phone, or you can come in and meet us in person.
So I'm going to close out the program today by just talking briefly about what's the difference between credit and non-credit, right? So one of the things about non-credit is, as Diane explained, is that you don't have to be admitted using the same criteria that we admit people to the college programs. But one of the evolutions in this industry, in the higher education industry, is the connection between non-credit and credit. And in the instance of the EMT program, Charter Oak State College will basically do prior learning assessment of the work that somebody would do in the EMT program and grant academic credit, which can then be used to continue on in your college career.
The Charter Oak accepts the National Registry certificate once a student earns that for credit. So that this can turn into a 4-credit class, and it'll count as an elective,
right,
on a transcript.
Right, and we don't have that arrangement right now with the equine program, but again, there are these other equine science programs out there, and it would certainly help if you were applying to one to have had this experience taking these non-credit courses. So all of these things kind of work together. So I want people who are listening today to realize that these are all college programs. Some you take for credit, some you don't take for credit, but you get lots of industry certification, or you get experiences that you can use to advance your career or decide on a path that you might want to follow in a college program. So I want to thank you both for being here today, and Diane especially for running our continuing education program, which is just a fantastic program here at Middlesex Community College. And I want to thank the listeners for being with us for this last half hour. If you want to find out more about Middlesex Community College, we are always on at MxCC.edu. You can find out about us anytime, night or day. Our special registration for the spring semester is Saturday, January 9th, but don't worry if you miss that date, because we're always here Monday through Friday, and we're happy to have you come and join us here at Middlesex Community College. This is Anna Wasesha wishing you all a very good day.